टेलीग्राम ग्रुप सब लोग सारे बोल रहे हैं कि ठीक। Right. So, there is anything, do let me know. Okay. We'll start with this new topic, osteogenesis imperfecta. The word osteo means bone. Genesis means formation. Imperfecta means not good. Not good. Right? Now, this disease is also known as brittle bone disease, also known as brittle bone disease. Brittle means something which is easily breakable, something which is easily breakable, right? Now, this is a genetic disease and inheritance pattern is autosomal dominant. Inheritance pattern is autosomal dominant most commonly. Now, the defective genes call 1A1 and call 1A2. Now, these are the defective genes. These are the defective genes. Call 1A1 and call 1A, right? These are the two primarily defective genes. Okay. Now, let's see how is bone formed. How is a bone formed? And then we'll be able to understand the problems in osteogenesis imperfecta. Now, bone formation starts with the membrane. First, you see membrane of the shape required will be formed. For example, body says, I want to form tibia. This kind of membrane will be formed. Body says, no, I want to form, let's say, body says that I want to form femur. This kind of membrane will be formed. Okay. Now, over this, collagen will be laid like this. These red lines are collagen. Collagen will be laid. Then interlinking collagen like this. Interlinking collagen fibers. First membrane, then collagen, and over that collagen, osteoblasts, they will form bone like this. Osteoblasts, they will lay the bone over collagen. In this way, a bone will form. Bone will form, right? What happens in osteogenesis imperfecta? So this is the collagen mesh. Over collagen mesh, body first step is to lay down collagen mesh. Over the collagen mesh, what will happen? Body will deposit calcium, right? And a bone will be formed. Now, normally, this is what happens. This is good quality collagen. Good quality collagen, right? Now, what happens in osteogenesis imperfecta? That body produces low quantity and low quality of collagen. Collagen produced in very little quantity, and even the collagen which is produced has got very poor quality, very poor quality, right? Now, because of that, bones, they are small, bones, they are weak, and bones, they break easily. That means your patient will have multiple fracture, multiple fracture. See, a typical patient of osteogenesis imperfecta would look like this. See, notice over here, very small height, fine, and then multiple deformed multiple deformed bones, right? So ligaments, they are also made up of collagen. So ligament will be lax. Lax means loose and weak. Teeth, they are also made up of collagen. They will be small in size. Fine. Sclera is blue colored. Why is sclera blue colored? Sclera is blue in color because it is very, very thin. Sclera is very, very thin. Now, when you will read the topic of ophthalmology, you will read the layers of eye. So you see, sclera. Generally, the sclera is white in color. Generally, the sclera is very thick. But in this patient, sclera is very, very thin. So thin that the next layer is clearly visible behind. Focus here. See here, what are the layers? Sclera. Behind the sclera, next layer is choroid. And choroid is blue in color. Now, in osteogenesis imperfecta, sclera is so thin that choroid is visible. Choroid is visible. Your patient will have very thin sclera. Sclera is so thin that choroid is blue in color, is visible behind sclera, visible behind the sclera. So blue colored sclera. Okay. Now this is the base of the skull. As you can notice, base of the skull has many holes, and these holes are actually called foramen. Okay. Now the biggest foramen happens to be foramen magnum. What is the purpose of these holes? Anyone? What is the purpose of foramen? Try to answer. Meanwhile, I'll draw a diagram here. What is the use of foramen? Foramens, they are used for passage of cranial nerve. They are used for passage of cranial nerves. Right? So let's say, buddies, this is the brain. Let's say this is the brain. Okay. Now, to the biggest foramen, what comes out? The biggest foramen, what comes out, that happens to be spinal cord. Spinal cord. Now, through the other foramen, other cranial nerves, they come out. Other cranial nerves, they come out. Right? Now, the problem is that bones are so weak that they can be easily deformed. They can be easily deformed. The base of the skull has foramen. These foramen are easily deformed. So foramen are also deformed. Consequently, what happens is that cranial nerves, they are crushed. Cranial nerves, they are crushed. Your patient will develop deafness, will deafness. Okay. Forward. What is the drug of choice? Drug of choice, it happens to be this phosphonates. phosphate. But what about the bones which are deformed? For them, surgical treatment. What is the surgical treatment? So field, Miller, osteotomy. Field, Miller, osteotomy. Right? What will we do here? See here. Let's say the patient comes to you with the bone like this. Okay. What you will do is you will cut this bone, cut the red shaded part. Much bone you will cut, right? Then will remove bone which you have cut will now after that what you will do is you will twist that you can make it straight, right? You'll bend it very hard like this. Now you will insert a rod, make the bone straight. The benefit over here, what did you get? Got a straight bone. Right? This is Schofield pillar osteotomy. Now it looks like Sikh kebab. That is why it is called as Sikh kebab osteotomy. Kebab osteotomy, right? Okay. Yes. Any doubts, anyone? Any doubts about this? Any doubts about the topic which we have studied? Or let's say after 15-20 seconds, I'll continue to the next topic. After 15, I'll continue to the next topic if you don't have any doubts. Dr. Vok Khan, Khan, typing. Let's wait for him. One more are typing. Okay. Right. Any nerve could be affected, but this nerve is commonly affected. Any nerve could be affected. This one is commonly affected. One is commonly affected. Yes, of course, but at least it will become straight. At least it will become straight. Size will reduce, but at least it will become straight. Okay, we move to the next topic there, achondroplasia. This happens to be most common cause of genetic dwarfism. Genetic dwarfism, right? This disease also is autosomal dominant. Well, dominant, right? There is fibroblast, higher fibroblast growth factor mutation. Precise mutation is FGFR3 mutation. FGFR3 mutation, right? That's important for NEET PG. Name of mutation. Now, 80% of the cases are fresh mutation. That means there is no family tree. Height of these patients be like 3 feet, 3 feet 2 inches. So they don't get to marry. When they will not get married, naturally they will not have children. The disease is not passed in families. Okay, 20% of the cases are fresh mutation, that is, there is no family. Now, here the distance, this distance is called arm span. This distance is called arm span, right? Arm span. Clinical features are short height, decreased arm span, decreased span. Okay, important. These patients they have normal IQ. Intelligence is absolutely normal. Now, look at your hand. All the fingers are of different size. But if you look at the hand of these patients, all the fingers they are of nearly same size. They are of nearly same size. This is called as starfish hands. Starfish hands. Starfish hands. All digits are of same size. All digits are of same size. Now, look at your hand. There are many lines, but here only one single line would be there. Only one single line would be there. This is called as simian crease. Simian crease, that is single prominent line on palm. Single prominent line on palm. Right? Now, next critical feature is trident hands. Trident hands is wide separation between middle and ring finger. Wide separation between middle and ring finger. Let me show you. What is here? This is the middle finger. This is ring finger, and there is very wide separation. The wide separation in middle finger and ring finger. Here also wide separation between middle finger and ring finger are called as trident hands. Trident hands. Okay. Now, what do we get to see? Champagne glass pelvis. We get to see champagne glass pelvis. This kind of pelvis is very wide, but it is not very tall. It's not very tall. So, pelvis wide, but not tall. Pelvis is very wide, but it is not tall. Then, about the vertebrae, have got bullet shaped vertebrae peaks, right? Like this. Vertebrae, they have peaks. Bullet shaped vertebra, they have. Now, typical pattern here is rhizomelic micro. The word micro means small. Ilia means limbs. Okay. Now, word rhizomelic has got a different meaning. See, in this patient, all the bones are small. All the bones are small, but some of the bones are very small. For example, humerus. For example, femur. They are very small. Okay. Proximal bones are much smaller. Much smaller. Right? In other words, we can write it that shortening of the bones is prominent in proximal bone. Shortening the bones prominent in proximity, prominent in proximity, right? That is rhizomelic micromelia, rhizomelic micromelia. Okay. Now, before we start with the next topic, what I'll do is I'll draw a small graph here so that you are able to understand, right? I'll explain with the help of this graph and then we will read in detail. Read in detail. Okay. So what we are going to read now is Paget disease. So let's say everything is normal. This is the activity of osteoblast. Okay. They form new bone. This is the activity of osteoclast. So it is like perfectly balanced, perfectly balanced. Everything is normal. At this point, what happens is Paget disease start. The next disease which we are going to cover, Paget disease. We are going to start reading Paget disease. Now, Paget disease, dear doctors, it has got stages. Three stages in the Paget disease. What happens? The Paget disease, stage 1. Osteoblast activity remains normal. Suddenly, osteoclast activity increases. Suddenly, osteoclast activity increases. Right? In the stage 1, osteoclast activity is high. Osteoblast activity is normal. Consequently, what will happen? Bone is destroyed. Bone is destroyed. Now, stage starts. Osteoclast activity is still high, but now osteoblast activity also increase. Osteoblast activity also in stage 2. What happens in stage 2? Osteoclast activity high. Osteoblast activity high, right? Then stage 3 will start. Osteoclast activity decrease. Clast activity decrease. Osteoclast activity decrease, right? But still above normal. Osteoblast activity also decrease, but slightly. Osteoblast activity, what will occur? Slight decrease. Right? These are the three stages of Paget. Three stages of Paget, right? Three stages of Paget disease. Let it sink. Let it sink for 20-30 seconds. Then we'll continue with the reading. Then we'll continue with the okay. Right. Okay. Start reading about the Paget. A Paget disease is also called as osteitis deformans. Osteitis deformans. It is a genetic disease and the defect is 5q T5 TER. Don't want to remember this? Perfectly okay. Just remember this. SQSEM1. This is also difficult, I understand, but this is important. Genetic defect SQSTM1. STM1, the genetic patient. Now, three phases. First phase, lytic phase. What happens in this phase? There occurs too much bone destruction, too much destruction by osteoclast. Right? Now, when bone is destroyed, bone is destroyed, things are released. Hydroxyproline and deoxypyridine. Right? These two are released. What do we get to see in this stage? There will be increased levels of hydroxyproline and deoxypyridine. They are said to be markers of bone adsorption. They are said to be markers of bone adsorption. Right? This is important here. Markers of bone adsorption. Right? Markers of bone adsorption. Okay. Now, this stage, X-ray will show you osteoporosis, that is, decreased bone density at some places. Circum. Now, you know that dense bone appears white and bone which is not dense appears black. What you see over here, everywhere the bone is normal, but at these places, bone is destroyed. Okay, another image. See, everywhere bone is normal, but at these places, bone is destroyed. Yes, right? This is osteoporosis scriptum. Okay, it's a difficult thing, so don't understand. Please don't hesitate. Stop me. Now, let's see what happens in long bones. What happens in long bone? Now, you see, normal, normal. Everywhere it is normal. On the other side, it is normal. But you see this point onwards. See, bone density here decreased. Bone density decreased. Bone density decreased. On the other side also, up to this point, everything is normal. But beyond that, you see that the bone density is decreased, right? Bone density. Now, if you try to fit flame, shape of flame, if you try to fit, it perfectly fits inside. It perfectly fits, right? That is why it is called as candle flame sign. Candle flame sign. Also called as blade of grass, candle flame sign, or blade of grass, right? That is seen in long bone. Is seen in long bones. similar. Okay, what happens in the mixed stage? So in the mixed stage, that is the active stage. What is? I really, my regrets for the interruption. I want you to meet someone. कोई बात नहीं, रंग बिरंगे कपड़े तो बैठी हैं. Ah, say hello. She happens to be my daughter. You say hello. That is these are the perks of taking class at home actually. तो उसका नाम रखा शिनचैन. Okay, so what happens in the mixed stage? So in the mixed stage, two things happen. First, large amount of large amount of bone is produced. Large amount of bone is produced. Now, because large amount of bone is produced, who is going to produce the new bone? New bone is going to be produced by osteoblast. Now, osteoblasts are very rich in alkaline phosphatase. So, alkaline phosphatase levels would be very, very high, right? Second, large amount of bone, large amount of bone is broken. Large amount of bone is broken by osteoclast, right? So the level of deoxypyridinoline and hydroxyproline, they are also high. Okay. Now on X-ray, if you see, you will notice that there is increased thickness. There is increased thickness of skull. Increased thickness of skull, right? Thickness of skull. This particular phenomenon is called cotton wool skull. Cotton wool skull. Cotton wool skull. Okay. Now, bodies. Let's say this is normal vertebra. Normal vertebra. Okay. Now, what happens here? That bone density increases. Bone density increases. This very vertebra would start appearing like this. Start appearing like this. Will start appearing like this. Right? Now, this particular phenomenon is called picture frame vertebra. Picture frame vertebra. Called as picture frame vertebra. Now, it looks like this. This is very commonly, when I say it, I actually mean it. This is very commonly asked as an image-based question. Image-based, right? Here appears like a photo frame. It appears like picture frame. Picture frame. Okay? Picture frame, but right? Now, another interesting phenomenon happens here. Let's say the carotids are bringing blood towards the skull. Now, this blood vessel going to give blood to two organs. The blood vessel here is going to give blood to the brain and is going to give blood to the bones. Okay. Now the problem is that bones, now they say, please listen to me carefully. Bones will say that now we are very, very big. We need more blood. What will happen? The blood was earlier going to the brain will now be shunted to the bones. Extra blood will be going to the bones. Extra blood will be going bones now. So vascular bones, they demand more blood. That is why blood of brain, blood of brain is shunted. Shunted means sent, shunted to bones. Consequently, पेशेंट आपका बेहोश होके गिर जाएगा. The patient will develop syncope. चक्कर खा के गिर जाएगा. The patient will develop syncope. Right? Now, this particular phenomenon is called vascular seal syndrome. Vascular seal syndrome. Vascular syndrome. Okay. Now, the third stage starts. In this stage, what did I tell you? That osteoblast activity is still very, very high, right? Osteoclast activity, it decreases. So consequently, what will happen? Bone size and thickness will continue to increase. Will continue to increase, right? Now, what happens is something very logical, very practical. Patient, suppose year 2019, he buys a cap. Winters, he buys a cap. Next year, the cap will be small because head has grown big. So every year, he will have to buy a new cap. So rather than buying a new cap, he will buy this hat. This kind of hat is called Tam O Shanter hat, cross hat, or Tam O Shanter hat, right? That is why name of sign is Tam O Shanter sign. Tam O Shanter sign means increasing skull size, increasing skull size. Okay, right. Most common clinical feature is bone pain. Now, it is commonly seen after 50 years of age. Male female incidence is equal. Now, let's say, buddies, these are cranial nerves. First image, second. First image, everything is normal, and second image is that of Paget disease. Now, remember, what do we have in Paget disease? Paget disease, we have got very thick bones. And because of that, what happens is that cranial nerves are crushed. Nerves are crushed, right? So, patient will develop hearing loss, cranial nerve paralysis, patient will develop hearing loss. Okay. Now, let's say this is a bone. Now, now this red line which I have drawn, this happens to be long axis of bone. Suppose there develops a fracture here like this. Suppose a fracture develops. Okay. Now, this is the fracture line. Blue colored line is the fracture line. Now, angle between these two lines you can see is 90. This particular kind of fracture is called transverse fracture. Transverse fracture. Same kind of fractures they are seen in Paget disease. How? Transverse fracture, they are also known as banana fracture. They're also known as banana fracture. See, this is the long axis bone, right? This is the fracture line. Angle between the two again is 90. Now, when you break a banana like this, right? It is similar. It's similar. Banana fracture. When you do the bone biopsy, get to see mosaic bone. So mosaic in Hindi means paheli, jigsaw puzzle, jigsaw puzzle. Now, why mosaic bone? Why do we get to see mosaic bone? Mosaic bones means irregularly, irregular arrangement, irregular arrangement of bone cells. Because body has formed this bone in a hurry. Body has formed this bone rapidly. That is why this bone is not properly formed. That is why the name mosaic bone. Mosaic bone. Treatment. Early stage bisphosphonate. Bisphosphonate. Late stage we cannot do anything. Late stage we will have to do osteotomy. Osteotomy. Why we have to do osteotomy? Osteotomy is done to release pressure, done to release pressure on nerves, done to release pressure on nerve. Now, teriparatide should not be given because Paget disease is already a risk factor of osteosarcoma. It's already a risk factor of osteosarcoma. Okay, right, buddies. Last topic here. After this, we move to the topic of tumors. If you have not understood anything or any specific point, please do let me know. I will be very, very happy to repeat. Meanwhile, I'll just continue writing this, but if you have any query, please don't hesitate. Yeah. So, ivory vertebra, very good. Thank you. So, eventually, what happens is that all the bone it develops like this, occurs very, very rarely. Now, this occurs during the third phase, occurs during the third stage, sorry. Ivory vertebra, entire bone will become, cancellous, will become very, very dense. Now, very good question. Why only second, fifth, seventh, and eighth? Fine. Let me show you. Just give me. Because you see, Base of skull commonly affected there, and these nerves are not protected. Second, fifth, seventh, and eighth, they are not protected by any structure. They are not protected by any structure. For example, you see, if you read your anatomy, you will notice that 12th cranial nerve is embedded, is very, very deep, present very, very deep inside the spinal cord. That is why it will escape injury. That is why it will escape injury. And these nerves have this image. These nerves, they are not protected by any other structure. See, second, now, on her Dr. Emmerich. See, already very narrow structure. Fifth, already very narrow structure. Right? Fifth. Seventh, you see already very, very narrow structure. Very narrow structure. Right? Here, see, cranial nerve 12th is nearly embedded in the foramen magnum. Foramen magnum. Right? Now, base of the skull, especially this anterior part, is commonly affected by Paget disease. Rear part is generally all the nerves can be affected, but these nerves are commonly affected. Nerves are commonly affected. Technically, theoretically, yes, you're right, any nerve can be affected, but these nerves are more commonly affected because their foramen are already very, very narrow, right? Osteosarcoma. You see, osteosarcoma in Paget disease, it occurs due to chronic irritation. It occurs due to chronic irritation of the bone. Chronic irritation of the bone. So if there is chronic irritation of the bone, naturally cancer will occur. Now, osteopetrosis is also known as marble bone disease. What occurs here that there is defective osteoclast. Right? What exactly is the defect? Defective carbonic anhydrase pump. Defective carbonic anhydrase pump the osteoclast. Right? That is why what happens is this disease, old bone is not broken and continues accumulate. Old bone will not be broken. Consequently, what will happen because of this? Consequently, bone density and volume, they increase. Bone density and volume, they, right? Now see, normal bone, outer part is cortical, inner part is cancellous. Remember, inner part, that is cancellous, has got space for bone marrow. But eventually what will happen? Bone density of the bone will increase everywhere. Even at the center of the bone density will be very, 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 very high. There will be no space for bone marrow. There will be no space for bone marrow. Bone density will become so high that there will be no space for bone marrow. Okay? Since there is no space for bone marrow, erythropoiesis, that means blood formation. Erythropoiesis, it occurs in liver and spleen. Your patient will have hepatosplenomegaly. Hepatosplenomegaly. Now, this erythropoiesis is inadequate. Inadequate erythropoiesis. Therefore, there might occur decreased white blood cell count, and because of that, there will occur infection. Infection, right? Now, these infections are considered to be most common cause of death. Common cause of death. Common of, right? X-ray. It will show you Erlenmeyer flaws. Now, this is Erlenmeyer flaws. Bones, they also look like Erlenmeyer flaws. Also look like Erlenmeyer flaws. Erlenmeyer flaws. Now, one is it will show Erlenmeyer flaws. Second, it will show sandwich vertebra. Sandwich vertebra. Now, how do sandwich vertebra form? See, old bone is not being destroyed. New bone is being formed. What will body do? Body will send the new bone formed to the periphery like this. New bone which is formed, body will send it to the periphery. Now, body will keep on sending new bone to the periphery like this. Slowly, slowly, bone density at the periphery would increase. Density at the periphery would increase. Right? Now, this kind of vertebra, they are called as sandwich vertebra, or they are also called as endobone. Endobone means bone within bone. Bone within bone. Right? See here. If you see, this bone is very dense. Bone at the side of vertebra is very dense. Right? Called as sandwich vertebra, or also called as endobone, that is bone within bone. Okay. Now, treatment is stem cell transplant. Stem cell transplant. That happens to be the treatment. Stem cell transplant happens to be the treatment. Right? Okay. So the topic of developmental disorder ends. Now we are going to start with the topic of tumors. Going to start the topic of tumors, right? Any query, any difficulty in understanding this topic or any of the topic which we have studied, please do let me know. Or we can continue with the topic of tumors. Next topic happens to be the topic of tumors. Bookman, Dr. Vukan, sorry. Let's wait for Dr. Vukan. He's typing something. Erythro. The word erythro means blood cells. Poiesis means formation. Erythropoiesis means formation of blood cells. Formation of blood cells. Normally, it occurs at bone marrow, but there is no space for bone marrow. So, erythropoiesis, it will occur in the liver and spleen. It will occur in the liver and spleen, which is inadequate. Inadequate, right? Last stage treatment, nothing can be done. If some cranial nerve is being compressed, that case you will do osteotomy. Otherwise, nothing can be done. Now the damage has already been done. The only thing is you can do osteotomy. Whatever bone is extra, you can cut that bone. Right? Okay. We'll start reading tumor. What is important in tumor? Age. Right? It is important in tumors location. Important in tumor biopsy finding. Right? It is important in tumor treatment. Now, our problem is that we have to study 7 benign tumor and 3 malignant tumor. Okay. Now, the problem with benign tumor is they all appear very, very similar. But yes, there are one or two catching differences, and we'll catch them only. Right? Okay. Less than 40 years of age, benign tumors are common. More than 40 years of age, malignant tumors are common. Malignant tumors are common. Now, they ask you what is the most common bone tumor. Most common bone tumor are secondary cancers from other organs. Most commonly is from prostate cancer. Is from prostate cancer. So your patient who has carcinoma of the prostate, his cancer will move to the bones. Right? So the cancer is not of bones, but it is from some other organ. But it has now come to the bone. Right? Let me show you here. What am I trying to say? Suppose here, let's say prostate of your patient is present. And in the prostate, there is a tumor. This tumor of the prostate might go to vertebral column. Here, the tumor will go to spine. Spine. Right? Here, it will form a tumor. Now, this is not originating from bone. This cancer is originating from prostate. Okay. Now, in males, it will be from the prostate, but females, they don't have prostate. In female, which cancer reaches bones? Carcinoma of the breast. Carcinoma breast. Okay. Now, some of the cancers are blastic. That means when these cancers they reach bone, they help in bone formation. Cancers they help in bone formation. Which cancers? PTM. That's a mnemonic. Cancer prostate. When it reaches the bone, it will help in bone formation. Cancer carcinoid. When it reaches the bone, it will help in bone formation. Medullary carcinoma of thyroid. When it reaches the bone, will help in bone formation. Okay. Now, some cancers are osteolytic. Osteolytic, that means they will destroy the bone. destroy the bone, like renal cell carcinoma and follicular carcinoma of thyroid. Once these cancers reach the bones, they will destroy the bone like anything, right? In cancer breast patient, 80% of the cases have lytic tumors, while 20% of the cases have blastic tumor. Yes, 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 exactly. Exactly. Dr. Vigneshji, you are absolutely correct. That is why in carcinoma of the breast, the metastatic lesion, we do perform what they call a bone scan, right? Okay. Now, cancers, they are rapidly growing tissue. Because of that, they prefer to remain near the source of blood supply. So, most common site, it happens to be dorso lumbar spine. Dorso lumbar spine. Tuberculosis, also the most common site is dorsolumbar spine. Let's see the differences between the two, tuberculosis and tumor. Tuberculosis and tumor. Wait. Now, tuberculosis will affect anterior aspect of spine. Tumors, they will affect posterior aspect of spine. Tuberculosis, IVD, intervertebral disc is destroyed. Intervertebral disc is preserved. Intervertebral disc is preserved in tumor. Preserved in, that is a difference in tuberculosis and tumor, right? Okay. Now there is a mnemonic. So carcinoma of the bronchus, carcinoma of the bladder, carcinoma of the colon. Now, these cancers, they can go to any bone, even smaller bone. Cancers, they can go to any bone, and not just spine. They can go to small bones also, radius, ulna, right? Tibia, fibula. They can go to far off places, right? Now, one liner question. Most common primary malignant bone tumor that happens to be multiple myeloma. That means the tumor which arises from the bone. This tumor, it arises from red bone marrow, arises from red, arises from red bone marrow. Multiple myeloma, it will arise from red marrow, red bone, right? Now, next is most common malignant bone tumor of non-hematopoietic. Non-hematopoietic means tumor is not from bone marrow, from bone marrow, right? This happens to be osteosarcoma. Second most common, chondrosarcoma. third most common, giving sarcoma. Dr. Ruchika, beta, there are two kind of bone marrow, active and inactive. Red bone marrow and yellow bone marrow. So red bone marrow takes part in erythropoiesis, the process of blood cell formation, right? Red bone marrow and yellow bone marrow. Yellow bone marrow just supports the red marrow. Okay, right. Anything up till now which you could not understand, because now we are going to start with benign bone tumor. Going to start with benign bone. Dr. Volkan, Dr. Vignesh ji, Dr. Emrick, Dr. Mazood ji, Dr. Shin, Dr. Sumi, anything which you could not understand, or I'll continue. Dr. Vignesh is typing. Let's wait for his response. Red and yellow dots will be there. Red and yellow dots will be there. Red and yellow dot like flame. I'll show you. I'll show you. Fine, I'll show you. First, let's continue here. So, first benign tumor we are going to start is osteochondroma. Now, this happens to be most common benign tumor. Most common benign tumor of bone. But unfortunately, the problem is that it is not a true tumor. It is not a true tumor. Why it is not a true tumor? Because growth stops at skeletal maturity. Growth of the tumor will stop at skeletal maturity. Fine. What am I saying? Now let's say this is the bone of a child, and this happens to be tumor. Now, this is the bone of adult. As you can see, this is huge in size, but tumor, it stops growing and it will remain small in size. Bone will go on to become huge, but tumor will remain of small size. Tumor will remain of small size. Okay. Now, gene mutations are only important for need. These syndromes are only important for need treatment. Excision is done if symptomatic. How can it be symptomatic? If it is compressing bursa or nerve, is compressing bursa or nerve. Nobody. What exactly are bursa? Bursa. They are fluid filled structures. Fluid filled structures near fluid filled structure near the joints. Now, what might happen is that this tumor may start compressing the bursa. There will be severe pain. This tumor may start irritating a nerve. That case also there will be pain. Okay, those cases will do the excision, the excision, right? Another important thing which I missed is that this tumor will arise from metaphysis. Tumor will arise from metaphysis. Arise from metaphysis. Metaphysis. Okay, tumor will arise from metaphysis. Okay, one tumor is over, right? Next is enchondroma. Enchondroma. Remember, buddies, the word en, it means inside. So this tumor is seen inside the bones. It is most common benign tumor of hand bones. Most common benign tumor of hand bones, that is phalanges. Phalanges. Okay. Now, this tumor is associated with two syndromes. Maffucci syndrome. This year FMG, this question was asked. Maffucci syndrome. I mean this December 24 FMG or January 25, whatever you want to call, is associated with Ollier. Right? This important question. Okay. This was all which is important about enchondrome. All which is important about enchondrome. Right? The third benign tumor, osteoma. Osteoma is also not a true tumor. It is just a bone overgrowth. What happens is at one point there will be extra growth of bone. At one point there will be some extra growth of bone. Some extra growth of bone. Right? Osteoma. Just a bone which is grown slightly. Now, might cause cosmetic disfigurement. That means it looks awkward, might look ugly, it might look bad, right? Next, it may block a paranasal sinus. You see, paranasal sinuses, air filled spaces around the nose. Now, the tumor may block a paranasal sinus. That case, clinical feature will be sinusitis, right? Now, treatment. If your patient is having sinusitis, excision. If there are no clinical features, there are no clinical features, treatment is reassurance. Reassurance means you tell the patient that it is not harmful at all. There is absolutely nothing to worry, right? That is what you tell the patient. Okay. Now, we move to the next thing, osteoid osteoma. This happens to be most common benign true tumor of bone. True tumor of bone, right? It keeps on growing. The growth does not stop. The growth does not stop. This line is taken from Robbins' textbook of pathology. The most common age, it is seen in the teenagers and in early 20s. Early 20s. Early 20s. Where do we get to see? Most common location is femur, followed by tibia, and which part? Diaphysis. Very, very important. Diaphysis. Right? Now, clinical feature. Pain is mild. It is so mild that it is relieved by salicylates. That means any NSAID, right? Pain is very, very mild. Now, dark center. Center is also called as nidus. Dark center and white periphery. Where? Here in the second page. Where did you write, buddy? Rises from diaphysis. Oh, that's wrong. That's wrong. Corrected. In the image, na? In the image, corrected. The image, they have given it wrong. Definitely arises from a diaphysis. Definitely arises from diaphysis. Definitely arises from diaphysis. Definitely arises from diaphysis. Dark center and white periphery. Dark center and white periphery. Now this image, that means very, very important image. Very, extremely important image. Never forget about this image, right? You see here, what do we get to see? Get to see dark center and white periphery. White periphery. Where do we get to see at diaphysis? Okay, that is the typical X-ray picture. Typical X-ray picture. Okay, print is radio frequency ablation or curettage. Curettage means to scrape, खुरच खुरच के निकाल देना, right? Okay. Now, osteoblastoma. What we will have to do is we will compare both of them, osteoid osteoma and osteoblastoma. Pair, right? Let's say on this side we write osteoid osteoma, osteoblastoma, osteoid osteoma. Here, where do we get to see? Get to see at diaphysis. diaphysis of long bones. Get to see osteoblastoma at spine. Osteoid osteoma is less than 2 centimeters, is more than centimeter. Now, osteoid osteoma, good pain relief with NSAIDs. Here, poor pain relief with AIDS. Now, treatment here is marginal excision. Marginal excision means normal tissue, some normal tissue around tumor is also, some of the normal tissue around tumor is also removed. Why? To make sure that entire tumor is gone. To make sure that entire tumor is gone. Okay, right. We move to the next benign tumor. Third last, osteoclastoma. It's also called as giant cell tumor. Now, most common age is 20 to 40 years and commonly seen in males. Most common site is epiphysis of distal femur. Epiphysis of distal femur. Now, there are 5 E's about it. This is diaphysis, this metaphysis, this is epiphysis. So, tumor is seen at the epiphysis. It is seen at the epiphysis. But it is not seen at the center. It is seen at one of the sides. So, first E, epiphyseal location. Second, eccentric location. Eccentric location, that means it will be present at one side. Expansile, rapidly increasing size. Rapidly increasing size. Eggshell crackling. I'll show you this in picture. Makes the bone very thin. En bloc excision is the treatment. En bloc excision means complete removal to prevent recurrence. Complete removal to prevent recurrence. Complete removal to prevent recurrence. Right? 5 is about the giant cell osteoblastoma. Let's watch a picture. See, tumor appears like this. Can you see, buddies? This is diaphysis, metaphysis, and epiphysis. It does not arise from center. Rather, it arises from one side of epiphysis, right? And if you can see, it is making the bone very, very thin. Makes the bone very, very thin. This is called as eggshell crackling. Eggshell crackling. Now, this typical image is called soap bubble sign. Soap bubble sign. Right? Typical image is called soap bubble sign. Now, Mano is typing. Let's wait. Okay. Now, why it is called as giant cell? So, if we do biopsy, I'll tell you, bete, I'll tell you. Next topic, Dr. Mano, is that only. Now, if we do biopsy, multiple giant cells with 40 to 50 nucleus are seen. See, Dr. Mano, beta, can you see any line here? Cannot see any line. If you see correctly, it is a single swelling. Single swelling. Dr. Mano, if you see aneurysmal bone cyst, this is aneurysmal bone cyst. Now watch it closely. You'll see that there are many fine lines. There are many fine lines. Fine lines. These lines, they are called as septa. Lines, they are called as septa. In giant cell tumor, there will be no septa. Fine. In aneurysmal bone cyst, there will be many septa. There will be many septa. Right? Okay. Next is second last benign bone tumor, simple bone cyst. Now, we'll read in pathology what is the definition of cyst. Cyst is a fluid filled swelling. Fluid filled swelling. Okay. Now, it is also called as unicameral bone cyst. Uni means single. Cameral means cavity. Now, where do we get to see? Get to this in hemophilia. Get to see this in Brody's abscess. Next, get to see this in liquefied enchondroma. Okay, now see. Dr. Mano, first thing you see. Incidentally, aneurysmal bone cyst is also called as giant cell tumor. Next difference, aneurysmal bone cyst is seen at metaphysis, while osteoclastoma is seen at epiphysis, right? The tumor which you have shown here is seen primarily at epiphysis, right? I'll share you many more pictures, don't worry. But I'll share you pictures from a standard textbook. Now, as of now, the main difference is if they will ask you in the exam, they will give you one clear image of osteoclastoma like this, and of aneurysmal bone cyst, they will give you multiple cavities like the image you have shared. Now, simple bone cyst. This is fluid filled swelling inside the bone. Most common age is 4 to 10 years. Most common site, upper end of humerus. Upper end of humerus. Okay. X-ray will show trapdoor sign, which is also known as fallen leaf sign. Also known as fallen leaf sign. Fallen leaf, trapdoor sign, or fallen leaf sign. Now, buddies, what happens is, let's say this is the cyst. It is filled with a liquid. Now, this liquid could be blood in hemophilia. Somebody kicks your patient, blood will accumulate in the bone. This liquid could be pus in the Brody's abscess. This liquid could be liquefied enchondroma. Okay. Now, nevertheless, the only point which I'm trying to convey you is that it is a liquid. What might happen is from this point, a bone fragment may fall inside the cyst, right? It will appear like this. Appear like this. This bone fragment we are talking. This is called as fallen sign or trapdoor. Okay. Now, treatment. Either we can give a steroid injection or a lesional. Right. Inside the cyst, we will give injection of steroid or will do curettage. That means to scrape, kurchana. Okay. Next, aneurysmal bone cyst. Aneurysmal bone cyst. Okay, aneurysmal bone cyst. Most common age is 10 to 20. Most common location is metaphysis. Metaphysis of uterus. Metaphysis of human. Now, what is the pathology? There is USP6 gene mutation. Now, this name is important for NEET P. What happens in this gene mutation? There is increased production of this enzyme. And because of, this enzyme can destroy the bone. So let's say this area enzyme is produced. Too much enzyme is produced. What will happen? Bone will be destroyed and only blood will remain. Only blood will remain. Now, slowly, what might happen is that this blood will lose all the oxygen. That is why it is called as blue bone. That is why it is called as blue bone. X-ray shows multiple septa. X-ray also shows finger in glove appearance? What is finger in glove appearance? This is the finger and this is glove. Finger in the glove appearance. Finger in the glove appearance. Right? Treatment is wide excision or nitrogen cautery. Wide excision or nitrogen cautery. Right? Wide excision or nitrogen cautery. Right, buddies? This was all about benign. Yes, anything which you could not understand, otherwise we'll take a short break and then we'll assemble again. Trapdoor sign, everybody's here. Now, whatever you see here in yellow color is liquid. Whatever you see here in blue color is bone. Now, what might happen is that one part of the bone will fall inside the cyst. One part of the bone will fall inside the cyst. From here, one part of the bone will fall inside the cyst. Remember, cyst is liquid. One part of the bone, let's say this room is full of water and one part of the roof falls. Right? That is the same thing here. Trapdoor sign. Yeah, we're about to take a break. So we'll assemble at 7:05. 6:50 by my watch. We'll assemble at 7:05 p.m. Nitrogen, we touch the tumor with nitrogen. Nitrogen is extremely cold. Nitrogen extremely cold, right? That will kill all the tissue. Will kill all the tissue. Like there will be no more bleeding. All the blood vessels be sealed. Right, buddies? So we'll take a break. All right, buddies, am I audible and visible? Please do let me know. If I'm audible and visible, please do let me know. Right. So we'll start with this tumor, osteosarcoma. This happens to be most common malignant tumor of non-hematopoietic origin. The word non-hematopoietic, that means it is not from bone marrow. It is not from bone marrow. Bone marrow is responsible for hematopoiesis. Marginal excision, you remove some part of the some normal tissue. Complete excision, you remove large amount of normal tissue. For example, here, let's say this is the tumor. If you remove this much area, this will be marginal excision. And if you remove this much area, this will be en bloc excision. This will be en bloc excision. This will be en bloc excision. Fine. This is en bloc. En bloc means complete. This this is marginal excision. Marginal excision. Right? Okay. So this actually arises from hard bone. Actually arises from hard bone. Now, osteosarcoma is the most common radiation induced tumor. Radiation induced tumor. That is why it is most common radio resistant bone tumor. That means radiation will not be able to kill it. Radio resistant bone tumor, right? It is the most common malignant bone tumor in children. Now here, most common site is skull. If the tumor, if the tumor is radiation induced, the tumor is caused by excessive radiation, the site will be skull. Otherwise, the most common site would be metaphysis of distal femur. Metaphysis of distal femur. Right? Now, this is of two types. Fine. First, primary osteosarcoma. That means there is no other bone disease. No other bone disease. Now, this occurs in younger age, 15 to 20 years of age. 15 to 20 years of age. Second type is secondary osteosarcoma. Now, this occurs due to bone diseases. Which bone disease? Paget disease. Fibrous aplasia. This is commonly seen between 55 to 75 years of age, and this is less common. Is less common. Now, genetic mutations which are associated. This is important for NEET PG, but for our exam, this mutation is important. Hereditary RB gene mutation. RB gene mutation. Now, it is said to be a bone forming tumor. Bone forming tumor. Just allow me 1 minute. Uh, at times you might find it difficult to understand. So what I'm doing is I'm sharing you a video there. First I'll explain it in the class, then I will share a video also. After the class, kind request that you watch this video. So I'm sharing this both in Hindi as well as in English. The first link is English, second link is in Hindi. Now, let's see what actually happens here. Let's say this is femur. Let's say this is tibia. Okay. Now, step by step, I'll write. I will be very, very slow so that you are able to understand it. Now, this blue colored thing is the periosteum. Okay. Now, first step, tumor arises. Okay. Second, tumor, it releases cytokines. Cyto means cell, kine means chemicals. Okay, it will release cytokines. Because of that, periosteum is lifted up. Okay, now let's see what is going to happen. Because of chemicals released by this tumor, periosteum will be lifted up. Periosteum will be lifted up. Right? Fourth, remember, periosteum is attached to the bone with the help of Sharpie fibers. With the help of Sharpie fibers. Okay. Next, what happens is stem cells are activated. Stem cells are activated. Next step, stem cells are activated. They are converted to osteoblast. Now, these osteoblasts, they start moving towards the tumor. Start moving towards the tumor. Start moving towards the tumor so that they can kill the tumor, so that they can actually kill the tumor. Now, this is called periosteal reaction to tumor. That means there was a tumor in the bone. what did the periosteum do to protect the bone? बोन के अंदर ट्यूमर आया, बताओ जी जरा पेरियोस्टियम ने क्या किया ट्यूमर को बचाने के लिए? पेरियोस्टियम ने क्या किया बोन को बचाने के लिए? Periosteum did form new bone to kill the tumor. Now this new bone is formed over sharpie fiber. ये जो नई बोन है पेरियोस्टियम ने बनाई, ये किसके ऊपर बनेगी? शार्पी फाइबर बैक. Okay, so if you see everything now in this image, there is a tumor. Because of this tumor, periosteum is lifted up. Now, if you can see, there are very fine lines, very fine lines. These lines are actually bone growing over sharpie fiber, bone growing over sharpie fiber, right? Now, another thing, here also you can see very fine lines, right? Now, this is called as sunburst appearance, sunburst appearance. Okay. Now, sometimes different situation happens, very different, completely different situation. Let's say there is a tumor over here. Now, what will this tumor do? As usual, this tumor will cause lifting up of periosteum. So what will happen? Because of this tumor, the periosteum will be lifted up. Now, periosteum, what is the periosteum trying to do? See, let me write quickly. First, there is a tumor. Second, tumor will secrete cytokines. Second, periosteum is lifted up. Periosteum lifted up. Third step, stem cells are activated. Right? Before this stage can occur, what will happen? Because this tumor is extremely aggressive, because this tumor is extremely aggressive, what will happen? This tumor will break the bone and it will go out. This tumor will break the bone and it will go out like this. Now, this particular area, this particular area is called Codman triangle. Codman triangle. Codman triangle. Okay. Now see here. The same thing you can see that the periosteum is lifted up. And this area is called Codman triangle. Area is called Codman triangle. Periosteum is lifted up. This is the tumor which is growing, has broken the periosteum, has broken the periosteum. So this area is called Codman triangle. Codman triangle. Okay. Codman triangle is periosteal reaction which is seen in aggressive, seen in aggressive tumors. Now, biopsy will show you nuclear pleomorphism. Nuclear pleomorphism means many shapes. many shapes. Large, hyperchromatic. Hyperchromatic means there is too much DNA. Abundant mitosis means rapid division. Now, all this means that it is an aggressive tumor. It is an aggressive tumor, right? Now, about the treatment. Since you see, I primarily practice general surgery, please allow me to use one example of general surgery. Okay. Now, let's say, buddies, I'm your patient. I came to you for treatment of breast cancer. Suppose there is a tumor over here. Okay. You remove the tumor. You remove the tumor. Now, please listen to me carefully. While you were removing the tumor, it might have happened that some cancer cells may have been left behind. सकता है आपने कुछ कैंसर सेल पीछे छोड़ दिए हों. How to kill those cancer cells? So you will do radiotherapy over here. Beam of radiotherapy will fall over this place and all remaining cancer cells would be killed. Right? Okay. So radiotherapy is used to prevent local reoccurrence of cancer. Got it? Next. Let's say some of the cancer cells they have escaped and entered into blood. Now what you will do? You will give an injection of chemotherapy drug. That drug will travel throughout the blood and wherever it sees malignant cells, it will kill those cells. Right? So chemotherapy is basically for distant control of metastasis, distant control of recurrence, right? That is the difference. Okay, now what happens in treatment of osteosarcoma? Neoadjuvant chemotherapy is given first and is followed by surgery. Since for many of you, this is the first class, let's read difference. For example, primary treatment, main treatment of any condition if it is surgery. Now, you give chemotherapy or radiotherapy. That becomes an additional treatment. That becomes an additional treatment. If it is given after surgery, it is called adjuvant treatment. For example, adjuvant chemotherapy, adjuvant radiotherapy. If given before surgery, called neoadjuvant treatment. For example, neoadjuvant chemotherapy or radiotherapy. Now, what is here? The treatment is neoadjuvant chemotherapy. So, first you will do chemotherapy, then you will do surgery. Why is this so? Chemotherapy is given first because most of the patients they have metastatic metastatic disease at time of first visit to doctor. So we want to kill the tumor which is traveling in the blood first. Okay, then we will do so. Right? That was all about osteosarcoma. Okay. Now, Ewing sarcoma is the second malignant bone tumor. Now, this is an aggressive bone tumor. Aggressive bone. Now, it involves bone and soft tissue also. Bone and soft tissue also. Now, it is made up of primitive round cells. Primitive round cells. You know, billions of years ago, when there was no life on Earth, how did the life start? Life started in the form of simple cell. Now, let me just, while we are able to use the internet, let me just right here, just add a picture. What a good picture there. Okay. Do you see? Life started in the form of simple cell like this. So there was a nucleus and there was a cytoplasm. Okay. Now here, all the cancer cells, they appear like this. The cancer cells, they have got big nucleus and yeah, and small cytoplasm. They have round shape. So most common age is 5 to 15 years. Most common long bone is femur diaphysis. Flat bone, it is commonly seen at pelvis, right? Clinical features are pain, fever, and swelling. Investigation, ESR, erythrocyte sedimentation rate, C, reactive gene. They are raised. They are raised, right? Now, X-ray will show onion peel reaction. Let's see how is this formed, right? Now, let's say a tumor arises. Now, this is the periosteum. Because of tumor cytokines, periosteum will be lifted. Periosteum will be lifted. And the periosteum, it starts forming bone. It starts forming bone. Stem cells are activated. Now, buddies, what happens is tumor stops growing. Periosteum also stops. After few weeks, tumor again starts growing. Periosteum also starts growing, and it starts forming new bone. It starts forming new bone. Tumor stops growing. Periosteum also stops. After few weeks, tumor again starts to grow. Periosteum also starts forming new bone. So this way, multiple layers will be formed. Multiple layers will be formed. Multiple layers will be formed. Right? Like this. So if you can see here, one layer, second layer, third layer, fourth layer, fifth layer. Many layers are present. This is called as onion peel appearance. Onion peel appearance. Now this is also known as lamellated appearance, also known as lamellated. Lamellated means layers, layers, right? Now, biopsy will show homerite nodules. That means round cells sitting in circles. Round cells sitting in circles. See, they are sitting in circles, right? When you see gene mutation, you will notice that there is translocation. This is a long concept. Translocation we'll study in pathology. Translocation between chromosome 11 and 22. Chromosome 7 and 20. Okay. Next, when you will do histochemistry, you know histochemistry, you will notice that tumor has CD99 marker. Tumor has CD99 marker. Okay. Treatment. Again, immunohistochemistry is a long concept we'll read in pathology class. Treatment is chemotherapy. Chemotherapy followed by surgery. But we must keep in mind that this tumor is radio sensitive. This tumor is radio sensitive, right? See, osteosarcoma, the treatment of osteosarcoma is primarily surgery. You'll have to cut and remove the tumor. Since the tumor is radio resistant, radiotherapy will not help. So what you will do is you will do surgery and cut, remove the tumor. But before you do the surgery, you will give chemotherapy, anti-cancer drugs to kill cancer cells which are traveling throughout the blood. First you will give chemotherapy, then you will do surgery. That is the tumor behavior, buddy. That is the tumor behavior. Tumor has varying period of growth. Sometimes the tumor will grow rapidly, then it will stop, then again it will continue to grow rapidly. That is tumor behavior, right? Okay. The last, malignant tumor, multiple myeloma. It is most common malignant bone tumor of the bone. It arises from red bone marrow. Most common age is 55 to 75, and this is extremely aggressive tumor seen in males. Seen in males. Now, bone marrow is unhealthy. Bone marrow has a tumor. So your patient will have anemia also. Clinical feature are bone pain, fatigue, weight loss. Weight loss is due to cachexia. Cachexia means nausea, vomiting, anorexia. Patient will not feel like eating anything. There's a call from the control center. Let me take this call, please. The call from the control center. हाँ जी भीम जी. अच्छा कॉल चल अभी क्लास चल रही क्लास के बाद डिस्कस कर ले. Sorry for the interruption. Cachexia, nausea, vomiting, and anorexia due to cytokines released by tumors. Your patient will have these systemic clinical feature. Systemic clinical feature, right? Fatigue, weight loss, to cachexia. Now, this is a short duration disease. Short duration disease. Why am I saying short duration disease? Because it kills the patient within 6 months, right? Now, X-ray will show punched out lytic lesions, which is called as raindrop skull. Okay. Now, see, tumor will come out and settle at this location. Here it will destroy the bone. Now, at this point, where it has been destroying the bone, what will happen? At this point, bone density will decrease, and this area will appear black on X-ray. This area will appear black on X-ray, right? Now, there are so many spots where the bone has been destroyed. That is why it is called as raindrop skull. It is called as raindrop skull. Now, due to calcium released, calcium released by bone lysis, when the bone is destroyed, calcium is released. Your patient will have hypercalcemia. Hypercalcemia. Treatment is chemotherapy by the drugs thalidomide, bortezomib, and age-old drug, like very old drug, melphala. Melphala, right? That was all about tumors. That was all about tumors, right? Now, after this, we'll start with the topic of arthritis. But meanwhile, if you have any queries, about this Topic of tumors. Please do ask. I'll wait. Dr. Mano is typing. Ruchika is also typing. Let's wait for their response, then we'll move forward. My kind request, please do watch these two videos. I mean, any of the video. First one is in English, second one is in Hindi. What is the purpose of giving you this video? You can watch it on twice the speed at your own comfort. See, methotrexate has got varied use. In orthopedics, methotrexate is currently used in rheumatoid arthritis. After the advent of thalidomide and bortezomib, we are not using melphalan and methotrexate in the treatment. Okay, Dr. Ruchika, right, bete. Now see, in hyperparathyroidism, what kind of skull is seen? Salt and pepper skull, right? Salt, he is white in color. Pepper, he is black in color, right? So there, what we get to see, salt and pepper skull. This is seen in hyperparathyroidism. Now, what happens is, due to, listen carefully, due to excess of PTH, excess of parathyroid hormone, bone resorption, resorption means destruction, occurs. Bone resorption occurs at many places, occurs at many places, right? So these areas appear black. Area appear black on X-ray. Okay. Now, what have you seen here? Bone resorption occurs at many places. The point which is important here is many places. Many places. So, because of that, what will happen? Because of this excessive quantities of calcium are released. Now, excessive calcium released, it settles at some places. And at those places, bone density increases. Bone density increases. Right? Now, these areas, they appear white. They appear white on X-ray, just like salt. Now, these areas, they appear black, just like pepper, kali mirch, just like pepper. Okay. Now, in raindrop skull, we only see black areas. we only see black areas, no white areas, because large amount of calcium is not released. I mean, it is large, but not so large that it could settle anywhere, right? That is the difference. So in raindrop skull, only black spot, and in hyperparathyroidism, salt and pepper skull, black and white spots both are seen. Black and white spot both are seen, right? Yeah. I know. It has been confusing a lot of people. That is why I made a video of this on my YouTube channel. Probably it is in this video only. Okay. Now we have to move slightly forward. A little forward we have to move. We have to skip some pages so that we can ultimately reach to this. This in your workbooks, it is probably page number 68. It's probably page number 68. I'll wait for 20-30 seconds so that you can open this page. Okay, so we have to study four different type of arthritis, and the first one is rheumatoid arthritis, right? Now, rheumatoid arthritis is chronic, non-suppurative. That means there is no pus. Chronic inflammation of synovial joints of unknown etiology. We clearly don't know that what is causative factor. Now, this is associated with HLA, HLA DRB1, HLA DRB1. This is associated with Epstein Barr virus. Epstein Barr virus. Now, buddies, what happens is, just because for many of you it is a first class, so that's why I'm taking some time and we are studying this thing in detail, right? Now, listen to me very carefully. Let's say there is a virus which enters the body of patient. Now, for body, this virus is antigen. What will the body do? Body will develop antibody against antigen. Okay, but what happens in autoimmune disease? You will study about autoimmune disease in pathology. What happens in the autoimmune diseases? Body, listen to me carefully. Body will develop antibody against one of its own components. For example, in my body, your body, immunoglobulin G is present. Immunoglobulin G is present. What happens in rheumatoid arthritis? Listen to me. What happens is immunoglobulin G is attached to Epstein-Barr virus. Body will say this is an antigen. Let's kill it. Let's kill it. So body will form antibody called IgM. Now this antibody will try to kill IgG. So IgM becomes antibody, IgG becomes antigen. Due to an unknown mechanism, body wants to kill IgG, immunoglobulin G. So what will happen? Body will develop a new antibody called IgM to kill IgG. Right? Now what happens is IgG, it collides with IgM. Now, when it collides with IgG and IgM, when they both collide, what forms? These are called as immune complexes. Immune complexes they form. Now, when immune complexes form, inflammation starts. Inflammation starts. But is watch it again. Suppose I am your patient. Okay. Let's say at this point, IgG is present. Normal part of the body, normal working component of the body it is. Body will develop IgM antibody. It will say, IgM, go and kill this antibody. Sorry, go and kill this immunoglobulin. So IgM will start from here. It will bind with IgG. IgG and IgM fuse with each other. Immune complexes form. Inflammation starts. Now this travels in the entire body. IgM plus IgG, they start traveling in the entire body. Wherever they go, they will cause inflammation. Right? Yes, buddies. Okay, I'll wait. Anything which you could not understand? Dr. Ruchika, Dr. Mano, Dr. Emric, Dr. Volkan. I hope I'm pronouncing your name correctly, bhai. Dr. Pratik, Dr. Sumi. Dr. Volkan is typing. Please allow me to wait for him for 20-30 seconds. IgM is binding with it to kill. Binding with it to kill only. Binding with it to kill only, but it is not able to kill. Now, most common age is 20 to 50 years. थोड़े क्वेश्चन भाई पैथो वाले टीचर के लिए भी बचा के रख लो, पैसे उनको भी मिलने हैं. They are also going to teach rheumatoid arthritis. What happens is IgM antibodies they develop against IgG immunoglobulin. Right? You see here IgG. Let me zoom it up. IgG now becomes antigen. Right? And IgM now becomes antibody. So both of them fuse with each other, immune complexes form. Now they will start the inflammation. They will start inflammation. Now, initial site, initial site is synovium. Initial site is synovium. So synovium is converted to pannus. Synovium is converted to pannus. So normal synovium, which is present inside my joint, your joint, it is very thin, lubricated, right? Whereas when it is inflamed, it is called as pannus. It is called as pannus. Allow me to use this image, help you understand the things. So you see, normal synovium is thin, moist, right? Whereas inflamed inflamed synovium, which is called as pannus, is dry, rough and thick. Dry, rough and thick. Okay. So first site of inflammation is synovium. Okay. What is the most common pattern? Most common pattern is symmetrical arthritis. Symmetrical arthritis. Suppose I am your patient. Let's say I am your patient. Wrist joint is involved on the right side. It will be involved on the left side also. Finger joints are involved on the left side. It will be involved on the right side also. Okay. Most common pattern is symmetrical arthritis. Minimum 4 joints must be named. Most common joint is metacarpophalangeal joint, PIP joint, and wrist joint. Wrist joint. Okay, see here. Now, this joint is metacarpophalangeal joint. This joint is proximal interphalangeal joint, also called as PIP joint. This joint is DIP joint, also called as distal interphalangeal joint. And this, of course, is wrist joint. Okay. Okay. Now here's something very important. DIP joint is paired. DIP joint is paired. Less common joint, hip joint. temporomandibular joint, rare joint, cervical spine. Which joint? Atlanto axial joint. Atlanto axial joint. Now, lungs, they are also inflamed. They develop interstitial fibrosis. Eyes, they are also inflamed. They develop conjunctivitis picta. That means dry eyes. Pleura, they will develop pleural if apart from that myocarditis, vasculitis, and aortic aneurysm. Aortic aneurysm they can develop. Aortic aneurysm they can develop. Right? Oh bhai, देखो, problem is I haven't had anatomy class. See, let's say this is femur, this is tibia. Okay, now this is the cartilage. Now, over the cartilage, there is very thin membrane present here. This thin membrane is called synovium. A synovium, it secretes synovial fluid. In case of rheumatoid arthritis, this membrane becomes like this. It becomes like this. This is called as pannus. Synovium, if it develops inflammation, that is synovitis, it will lead to the formation of pannus. So inflamed synovium is called pannus. Now, due to ongoing inflammation, rheumatic nodules, they form they form below the skin, form below the skin on extensor surface, extensor surfaces. Most common is olecranon. Most common is olecranon, right? Most common is olecranon. Okay, right. So as of now, we will have to end the class over here. No, 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 no. It could be, Dr. Mano, it could be that cervical spine is the most common part of spine which is affected by rheumatoid arthritis. No, it is the least common joint to be affected. Okay. Now, yesterday also I could not send the PDF. What I'll do is I'll send the PDF of yesterday and today's class right now. Right? And if you have any queries as of now, you can ask me. Otherwise, we'll have to end the class over here. Yes, buddies. Any queries, please? या डर गए रूमेटॉइड आर्थराइटिस से? I don't know. They'll surprise me. As of now, the plan is 5th Feb only, but they might surprise me anytime. They said today you have to take a class. As of now, the plan is 5th Feb only. Okay, I'll add it. But you'll have to wait because what I do is I'll send the picture in the itself. Here one. Watch this image. That is about the bone scan. See these dots, bright white dots. These are the site where cancer has gone. These are the site where cancer has gone. On the image, and you will see bright white spots. Right, buddies? Kindly allow me to end the class.